Hello and welcome to Legacy Brokers. This is our video series on healthcare reform, and specifically in this video we'll explain how to calculate, file, and pay your PCORI fees. The Patient-Centered Outcomes Research Institute fee, better known as the PCORI fee, was established under the ACA, and it's a requirement for all health plans. Now, if your plan is a fully insured program, the insurance company actually collects and pays the fees as part of your monthly premium. But with a self-funded plan, the obligation to pay the fee falls back to the employer. As a client of Legacy Brokers, you have a complimentary subscription to HR 360. Within this massive library, we actually find all the details for the PCORI fees here. Now, how do we calculate the fee? First, we have to determine when our plan year ends. For example, for plan years ending on or after October 1st, 2016 and before October 1st, 2017, the fee is $2.26 per average number of lives covered under the plan. And for plan years ending on or after October 1st, 2017 and before October 1st of 2018, the fee is $2.39 per average number of covered lives under the plan. By now, your self-funded plan administrator should have already issued a summary report to you calculating the average number of covered lives specific to your group health plan for the appropriate reportable plan year. The fees are due July 31st each year. In order to file and pay the PCORI fees, you'll actually need to file a Form 720 quarterly federal excise tax return. Now, if you already file this return quarterly for your company, then you'll just need to make a simple addition to your filing for the second quarter, which we'll get into next. But most employers don't actually file this form every quarter. If that's you, you're watching this video, you are not alone. First, we just need to locate the most recent version of the IRS Form 720. Conveniently in the HR 360 portal, there's a link. We've also added the link to the comments below this video. Now, the form itself, as well as the detailed instructions for filing the form, can also be found on irs.gov. It's an 8-page form, so that can seem a bit daunting, but let's break it down. First, you'll simply need to enter your company name, the company address, your employer identification number, and for our purposes, we're using a quarter ending June 30, 2018. We're going to skip the rest of page 1, as well as the first half of page 2, until we get to part 2 on page 2, and this small section here is the most important section. Most self-funded plan sponsors actually fall into the category of applicable self-insured health plans. So we need to determine when our plan year ends, and then we have to enter the average number of covered lives in the appropriate box and the fee for that particular plan year. For our purposes, let's assume that we had a group health plan with on average 10 covered lives. That counts all employees, spouses, and children on any given month. On average, for the most recent plan year, we had 10. Then we're going to assume that our plan year ended December 31st, 2017. So our renewal was January 1st, 2018. So 10 times our $2.39 gets us to a tax of $23.90. And that's what we're going to plug into the tax section. We're going to carry that number all the way down to box number 2, the total, $23.90. And we're going to move on to page 3 and carry that total again to the top of page 3. And we're going to carry that down to our balance due, $23.90 in box 10. We're ready for a signature and a date and our title. We'll print that later. Now we're going to skip page 4, page 5, page 6, page 7, all. all the way to page 8 where we'll find the payment voucher. Pretty simple. We'll enter our employer identification number. We're reporting for second quarter tax period. We're going to carry our total tax of $23.90 down to the payment section. Enter our business name, our address, etc. Now we're going to print all 8 pages of this form. And we're going to make sure that we sign and date on page 3. Going back to our instructions from the irs.gov website, we're going to find where to file this form, and that is with the Department of the Treasury, Internal Revenue Service, Cincinnati, Ohio. That's all there is to it. Once we have the payment issued to the Department of the Treasury, along with the completed Form 720, we're ready to mail. Make sure you keep a copy in your files for your records, and be sure to call your Legacy Brokers affiliated agent with any questions regarding this form or any other healthcare reform updates. That's as simple as that. Thanks for watching. We'll see you next time.